September is National Prostate Cancer Awareness Month. Joining us this morning with more are Dr. Douglas J. Rivera, a board-certified radiation oncologist and medical director at Austin CyberKnife, and Dr. Lucas Giacomides, a urologist at Greater Austin Urology. Good morning, gentlemen.
Good morning, Rosie.
Good morning.
Lovely to have you both in studio. Let's talk about September. It's just around the corner. What's the purpose of Prostate Cancer Awareness Month, and why is it needed, Dr. Giacomides?
Well, I think most people are familiar with October and Breast Cancer Awareness Month. You know, people wearing pink on the NFL, and everyone talks about it. And it's a very important cancer. I think we get sort of left to the side as Prostate Cancer Awareness Month, and what people need to realize is that it still afflicts 160,000 men a year who will get diagnosed,
Wow.
of which 30,000 men in the country will die. In Texas alone, there's 11,000 new cases every year. So we just want to be raising awareness about the importance of screening and also identifying some of the risk factors and some of the other tests we need to do to make sure you don't have it.
Let's delve a little bit more into the statistics of prostate cancer, especially when we start to talk about who gets it, you know, who has a better chance of surviving it, that sort of thing. Let's talk about some of those.
Yeah, I think the biggest factor to realize is age, of course. You know, what people don't realize in some studies that after the age of 65, 1 in 3 men in their 60s have it. And
That is a huge percentage.
Right. When you get to 70, it probably goes closer to 50%.
Wow.
And by the time you get to 80, it's really about 80%. So at some point, at least 1 in 6 or 1 in 9 men will get diagnosed with this disease in their lifetime. So that's the big factor, of course. As we get older, we start to pay more attention to it. Another big risk factor, of course, is race. African American men are actually twice as likely to die of their disease than Caucasian men. So we really want to stress to those folks, again, to find the cancers that will kill you, not the ones that are just indolent and aren't going to cause any problems. And then finally, just genetics. If you have a brother or if your dad had it at a relatively younger age, then you are at least 2 or even 3 times more likely to get it yourself. So in those cases, we back up the screening a little bit earlier, maybe even as early as your 40s.
I see. Okay. And let me just ask you real quickly, do you feel that any of those numbers could just be improved by men who are seeking medical help more early? Because I know that there's kind of, you know, the feeling that guys like to put off going to the doctor.
Right. I think, you know, things like Movember, you know, November also raises awareness. I mean, we all wear our mustaches. I don't know about Dr. Rivera, but I certainly do. But you know, truthfully, you know, we don't need many excuses not to go to doctors. So it's important to realize that, you know, some of the symptoms that are there are usually when it's almost too late, in terms of bony metastasis, when it's already causing you a hip fracture or even worse, spinal paralysis. At the early stages, there are no symptoms. So a simple blood test that costs $20 can potentially save your life and cause you much less grief much later.
Wow, okay, well that's great to hear. And Dr. Rivera, let's turn to you. How can CyberKnife help with prostate cancer treatment, and what exactly is CyberKnife?
Well, let me put it within context. When we talk about the treatment of prostate cancer, if we do treat it, and that's something we have to decide when you see your doctor and look at different things, but really the best study things are either going to be surgery or radiation. So in regards to radiation, we have a special tool at CyberKnife which uses very focused radiation. Oftentimes, you know, the standard of care now would be to treat people 45 times over even 9 weeks.
Wow, that is a big number too.
It is. It's a big commitment, especially for folks that are driving long distance. And for the well-selected patient, we can even treat patients on the CyberKnife as little as 5 fractions.
Wow.
So it really kind of shortens the duration, and still is equally efficacious.
Yeah, and I know in addition to that, just real quickly here, there are some other big benefits of using CyberKnife.
That's right. I mean, because we are able to use a very condensed, short course and very focused radiation course, we're able to kind of really, again, truncate that into a minimal number of treatments.
Yeah, and I know effects otherwise are minimal and painless. That's something really wonderful to see. So doctors, we really appreciate both of you sitting in to talk to us about raising awareness for September. Thank you so much for being here this morning.
Well, thank you. We appreciate you having us.
Of course. Austin CyberKnife is located on I-35 near the Del Seaton Medical Center at the University of Texas. Call them 512-324-8060 or go to austincyberknife.com for more details.